For more than 2 years, the world has seen the worst pandemic, a once-in-a-century event which has altered the lives of millions around the world. Millions have died, and the pandemic is not really over. One of the groups which has been instrumental in trying to help millions around the world, the Serum Institute of India, the AstraZeneca vaccine, what we call Covishield in India, has had a huge role. Adar Poonawalla with me over here in Davos in Switzerland. Thanks very much for being with us. You know, when we first started speaking about vaccines a couple of years back, the real hope was Covishield, and it still continues to generate so much hope in our country. I just got my booster jab about 2 weeks, just about 2 weeks back. But the question I really want to ask you is, when are we going to be prototyping a vaccine which deals with all the strains of COVID?
Well, you know, that's well put, because the next generation vaccines, given enough time for research and development, should ideally be able to even block transmission.
Right.
You know, what we saw this time around was great vaccines that could prevent hospitalizations and severe disease. But as you rightly said, you know, to deal with future mutant variants and to prevent breakthrough infections, the real research is on now, which does take a little bit of time. And maybe in a year or two, we could see, you know, a second generation vaccine that could prevent transmission also. And that's how you really work toward eradicating or minimizing the spread of a disease.
And are you in talks with groups looking to develop this technology? I mean, are we going to see an Indian second generation vaccine is my question.
I hope so, certainly hope so, but you know, it's still very early. I think we should wait at least a year and we'll know by then. But you know, even the research at the moment is based on combining the COVID vaccines with flu vaccines.
Right.
And that could be an ideal booster for people to take every year. You know, where you just have one jab and it takes care of, you know, a family of viruses.
Because that's the other point. We've all had our boosters now, but we'll need another booster until such time as there is a next generation drug available. So I mean, to say that we need to have our next booster 1 year later is hoping against hope that it lasts that long, and it doesn't. The technology, I mean, we know the science now much better than we did a few years back.
Well, I mean, if you take 3 shots, the data is very clear that you do have immunity, you know, beyond a year. At least Covishield and the AstraZeneca vaccine has a very good T-cell response, a long-term response, which is why you're seeing, you know, the cases in India and the hospitalizations, most importantly, at a much lower level compared to, let's say, the US or other parts of Europe, where, you know, other vaccines have been used, which are equally good, but they don't have that long-term T-cell response that we're looking at with the traditional vaccines.
We'll talk more about vaccines in a bit, but you know, you're here in Davos because you really are hoping to bring together leaders around the world to sort of be in a position to deal with pandemics better.
Absolutely.
I mean, that's one part of it.
So I mean, I'm hoping to use the platform here and everyone, whether it's the world leaders or the multilateral organizations, to actually draft some sort of global pandemic treaty which would help the global solidarity of coming together. You know, we all know what went right and what went wrong in this pandemic, and some of the things that went wrong in terms of sharing of raw materials and vaccines, recognizing vaccine certificates, global harmonization of clinical trials and manufacturing, you know, making more vaccines accessible and treatments accessible globally. So these are the kind of things I would hope to establish, where if you had a global pandemic treaty that would address these issues, it would definitely make it easier with a predefined framework for leaders also to explain to their constituents and to deal with other countries in a predefined framework. Now, it may not be enforceable because, you know, in a crisis, a leader would do whatever they have to do to protect their country, and rightly so. But at least it offers some kind of framework and a commitment, like you see for climate change and other sort of global
Are you drafting it, Adar? Have you got a draft which is ready for circulation?
Yes. So I've been working on it, and I'm going to be circulating that at Davos in some closed door sessions as well with some multilateral organizations, and then we'll see how it's taken up forward from there, because it has to be one of those organizations that takes it forward. One individual country can't do it. So let's see how that goes.
We talk about the science of the vaccines, but has this been a real learning experience for you that, in terms of coordinating the effort to deal with a pandemic, we around the world lacked? We fell short of our own domestic requirements at a stage. We stopped exports. The UN fell short. Gavi fell short. Different manufacturers had different priorities. The science was different. The WHO was there. They took a lot of time in many cases. So lives were lost, let's face it. We don't know how many, but the process was slow.
Again, because it was a fragmented effort rather than a global coordinated response. And that's what I'm trying to bring here. So let's see what happens.
So let's talk a little bit more about the India situation. Now, we've got Covovax. It's been granted emergency use licensure in India, but it's still difficult to get for adults. It's not there last I checked on CoWIN. Am I wrong? Or
well, I think there's some procedural issues, but I think most of the adults, as you know, have been vaccinated with either Covishield or Covaxin. So for dose 1 and 2, I don't think there'll be many takers for Covovax. But I think, as you know, it's approved between 12 and 18, and very soon for going down to the ages, down to the age of 2 or 3. So I think, now we need to get the children vaccinated and protected. I think, looking at toward future mutant variants of concern, it's important to vaccinate the children also. So I think that's where India is at the moment, and we've done very well. Our coverage is far higher than most countries. If you look around, I think, what was it, 90% of adults, more than 90%. I don't think any country's reached that figure.
And our numbers are huge. So that's good. This is a question we keep getting in the innumerable programs we've done. How do I know a vaccine is safe for my 2-year-old? How would you respond to that?
Well, a lot of data and safety. If you look at billions of doses now being used of the AstraZeneca vaccine in adults. We've had extensive studies in children as well for Covovax, which is for children. The AstraZeneca vaccine is for 18 and over. So Covovax has done studies, all over the world. We've done studies in India. And we've even started thousands of vaccinations in India for children. So far, so good, touch wood. Things are looking good.
Let's talk about the other vaccines which, we've discussed in the past. The nasal vaccine. You were, in preliminary trials when we spoke about this more than a year back. Where does that stand? Does that still have a say potentially?
We sort of slowed down on it because how many vaccines were we going to make, given the coverage? But to answer your earlier point, the nasal vaccines have the ability to block transmission.
You're clear about that now.
There's a higher chance of that. And if that is proven to be true in trials, then yes, as a booster, that would be ideal. But the problem with nasal vaccines is, and even when we had a nasal flu vaccine, the uptake wasn't so good because it's very hard to establish a immune response. Because, the IgG, IgA antibodies that you measure, you don't get that when you give a nasal vaccine. But it does build a lot of immunity and can block in your mucosa, preventing the virus from entering your system, and that's really what you need to block transmission.
Just another point, when we were talking about dealing with a global pandemic, the SII has actually invested a great deal of money in a facility where you can really move fast in expediting production. So when you talk about a response, the infrastructure, the hardware and the people who do this actually exists in our country.
Absolutely. So one of the lessons that we learned was that we need to be able to vaccinate our own nation in a matter of 3 months. God forbid there's another pandemic. We can push the button and produce, now we have a 4 billion dose capacity from 1.5 pre-pandemic. And
this is because of the new facility.
Correct. And that's added another 2 billion doses to our capacity. So now we could technically make whatever India needs within 3 months, and then immediately, export and support other nations as well. Now that is the level of our bandwidth, and don't forget, other manufacturers also have scaled up. So India now has roughly a 6 billion dose capacity between all the Indian vaccine manufacturers combined, maybe even 7 billion. So, you know, we are now far better prepared
Yeah.
in terms of capacity also going forward.
Let's talk a little bit about inequity in vaccines. That's been a huge problem in the past because we weren't allowed to export. Now we are exporting a lot more. So when it comes to made in India vaccines in other parts of the world, where do we presently stand?
Well, at the moment, as you know, we've got a lot of capacity.
Right.
And we have been exporting to more than 80, 90 countries as of November 2021. We exported a lot even in January and February before the second wave hit us. So we are in a very comfortable position. The African nations are slowly scaling up their ability to vaccinate, but as you see cases going down, the urgency for people to come forward and get vaccinated is dwindling, and that's you know, a problem.
That
because
is a problem.
A lot of people are not even going in for their second dose as a result, and we need to at least complete their primary and secondary vaccinations. So we have to keep advocating and pushing that as we go along this year.
One final question to you. You know, you would have seen the World Health Organization numbers on the number of COVID fatalities in India. We have our own numbers as well. But I think the key point over here that we keep forgetting is that either way the numbers are stupendous, and I think it's just a reminder of what we dealt with. It sometimes doesn't sink in. How did you deal with this entire thing, knowing that this is something that's going to be out of control? This is something which did get out of control. Did you sleep easy at any time in the last 2 years?
Well, you've been following our journey quite closely, and you know, given the uncertainty that existed, even in terms of being able to access raw materials and things that we would normally take for granted, you know, it was permissions and licenses, raising the capital. To do this, we invested more than 10,000 crores, you know, between our capital and, you know, from Bill Gates and from other countries and India's support as well. So there were so many sleepless nights and lessons that we've learned. And I feel we're far more prepared. We can, you know, make better decisions, faster decisions going forward. And I just hope we're never in that position again. But if we are, I'll tell you, there is no country that is more prepared than India. I mean, you look at our testing infrastructure, you look at our health systems also, and you know, hospitals and everything. So, you know, we're in a very good place now.
What about fundamental science in making a lot of these vaccines? The SII is known as a manufacturer. Is that an area that you'd also like to sort of get into?
Well, absolutely.
Basic science.
You know, you've got all the new vaccines, HPV that we're going to launch, which is for cervical cancer in women later this year. Hexavalent. So we are doing a lot of research to combine vaccines, even new vaccines. You know, we've got our own patents for the pneumococcal vaccine that we made and launched in 2019 to prevent pneumonia in children. That's one of the highest killers of children below the age of 5.
And this is science in India,
yes,
or your
yes,
international?
Yes, absolutely. We filed our own patents. We've got the strains from, you know, the US, but we've formulated and made our own vaccine. So we've got a 5-in-1 meningitis vaccine coming up as well. So a lot of the, you know, pipeline products that were sort of deferred for 2 years because I wanted to just focus on COVID will now take shape. Even dengue. You know, we've got a dengue.
You'll have a dengue vaccine.
Yes, we're starting trials with the ICMR this year.
Phase 1.
Yes, and I think maybe in 2 years you'll have it.
This will be the world's first dengue?
No, it'll be the world's second dengue vaccine. There's one made by another company as well. But we hope to have a much higher level of efficacy. So let's wait and see how that goes.
That's going to be huge in the India context.
Yes.
Lovely speaking to you, Adar.
Pleasure.
Thank you very much.
Pleasure.
There you have it, Adar Poonawalla, talking among other things about the need for countries around the world to actually come together to ensure that if there is another pandemic, there's a way, you know, there's a structure in place to ensure that that can take place. In Davos, Vishnu Shom for NDTV. Well, the India story in Davos this year is one where we've seen the involvement of so many states. The point that is being made by several leaders is that invest in India is a very real option and that there are avenues where India has excelled. One of the states which is looking to promote the India experience is the state of Karnataka. They've got a very large pavilion over here in Davos, and we are delighted to have the Chief Minister, Mr. Bommai, with us. Thank you very much, sir, for being with us. So my first question to you, one of the key areas that Karnataka wants to invest in or bring in investment is semiconductors. Could you tell us a little bit about that and how that promises to transform a great deal?
Yeah, semiconductor is one of the important development. Since COVID, the semiconductors all over the world has become a talking point because of the shortages. And there are very few countries manufacturing it. Now the world has opened up for semiconductors, and our Prime Minister Narendra Modi ji has taken it on the mission mode, and he has announced a very big package as an incentive to those who come for semiconductor, because it is a product which has to be incentivized.
Right.
Then only it will be feasible. So we are also come with the policy where further incentives are there. And more than that, Karnataka being a very, very tech savvy and tech human manpower,
Right.
it is a natural attraction for the people who are in semiconductors
Right.
to come to Karnataka. And way back, about 3-4 years back, only we had a semiconductor policy.
Right.
And we have been very keen in manufacturing semiconductor, and we have got 2-3 public sectors who are there in related manufacturing related items in semiconductors, like BL and HL and all those people.
Sure.
So there is an ecosystem already prevailing.
Right.
Therefore, a lot of people are talking to us.
Well, the issue of the IT sector is so very important. It's been an area of traditional success for Karnataka. But along with IT comes the need for infrastructure development in cities like Bangalore, in Bengaluru. Is that a concern for yours? Because the argument at one level is that infrastructure is saturated, the city is saturated, and yet you want to bring in more talent. So how is that a big focal point of yours?
See, IT sector, you can't imagine Indian IT growing without Bangalore.
Exactly.
For the sake of India, Bangalore has to take the lead, the position which it is. And for the sake of Karnataka too. So, see, certainly Bangalore was not really very well planned. So there are some issues, I don't deny that. But it is not as big as it has been made of, basically. And it can be fixed, number one. And secondly, we are planning out of Bangalore. Beyond Bangalore is our slogan. And now a lot of IT sectors are coming beyond Bangalore. And some of them are just outskirts of Bangalore.
Right.
See, now the issues which they have been raked up is in 2-3 residential areas where it is converted into IT hub.
Yeah.
So the residential needs and IT needs have been now at crossheads.
Right, right.
But here we have got a plan where near the airport and surrounding places, about 40-50 kilometers from Bangalore, we are developing hardware and software parks. And lot of private people are also investing in IT parks.
Right.
So there is a huge space and huge facility for anybody to come. That's why for last 4 quarters, we are the number one FDI investment,
Right.
and especially in IT, hardware and software.
Right.
So that itself shows
Yeah.
that the real picture is that there is enough infrastructure in place, little away from the Bangalore, and people are ready to come there.
Right.
A lot of international companies have come there,
Sure.
and is going to come and is continue to come.
Right.
The way the response is from day to day, and in not only in IT/BT, in startups,
Right.
we are the leaders. In biotech,
Right.
we are the leaders.
Right.
In renewable energy,
Right.
we are the leaders.
Right.
In EV, it's going to be a EV vehicle manufacturing hub. So the saga of technical driven economic growth in all these fields will continue, and of course, as a responsible government, we will fix up the problems.
Aerospace is another area of excellence. But again, even within the government, there have been talks of taking away Aero India from Karnataka, moving it to other parts. And I know there's been this discussion back and forth, but I can't imagine Aero India without Yelahanka, which is why I'm curious.
I know. Yelanka has been like a mother for all aero shows, and with all facilities fixed.
And business.
And I want aero air show to be a permanent feature in Bangalore, in Yelanka.
Yeah.
That is our real need
Right.
and our demand also.
Right.
But the aerospace has also grown in many folds.
Yes.
There are a lot of R&Ds in aerospace, in defense sector,
Yes.
in government of India sector, as well as in private sectors.
Yeah.
So aerospace is a very niche area, and we have got aerospace park also,
Yes.
especially, and a lot of investment is also
Right.
coming there. We are coming out.
But is this a battle within the government, between you and this? Because the centre wants, for example, UP to develop more, Gujarat to develop
No,
more,
see,
shift it out.
See,
Is this a...
it is aero show is more of a defense.
Right.
So they want to showcase defense in different places in different times. That is the issue.
Right.
There is nothing more than that.
Right.
But we have moved ahead of aero show.
Right, of course.
We have moved ahead of aero shows.
Right.
And a lot of international players are already come, settled, and a lot of exports from Bangalore going all over the country, including one of the prestigious companies. So we are very well grounded as far as aero shows are. I mean, air show is concerned as well as aerospace is concerned.
So one final question. You're here in Davos, you're looking to bring in investment, and yet the headlines back home in Karnataka have to do off late with this conversion bill, the anti-conversion bill and all. Does that affect, the message that you're trying to sell here?
It is nothing to do with investments, nothing to do with growth story. See, I'm telling you, for the last 4 quarters, a lot of other issues, domestic issues are there. You tell me which state doesn't have domestic issues, one way or the other. But the confidence of the investor, both outside the country and inside the country, is so huge that it is nothing to do that. And these are the laws which come, and it will have a scrutiny of courts also. And these are the issues, domestic issues which have been raised up. We have to tackle them also.
Right.
So that is also our responsibility. However, these things are never going to affect the growth story.
Right. And so inflation, the government has taken some important steps. For example, fuel and diesel. There's been a decision by the centre. Now, is that something that you can add to in Karnataka? Are you considering that? It'll bring relief to millions in the state.
See, after GST coming, states' options are now limited. Therefore, we have to look into our resource mobilization, our financial condition before we venture out.
So nothing further that you can look at this
I'm
stage?
looking at it very closely.
One final question, sir. There are global headwinds now. I mean, whether it's the war in Ukraine or, food prices increasing internationally. How much is that impacting the growth story, say, in Karnataka? I know it is at the India level. All countries are being affected. Is this a worry also as you try and sell the Karnataka story worldwide?
See, this food scarcity is at present, it is a few country specific, which can be tackled with this globalization. But a long-term food security policy is necessary for the globe, because the land is shrinking, the people dependence on the land is increasing. So we have to save the land, the soil, the natural resources.
Right.
And we have to bring more productivity, more yield crops, and very less harmful insecticides. Planning it properly is a long-term issue which you have to tackle. It is not only the governments, it is the society has to do it. And Karnataka is been doing it because we have got 10 agroclimatic zones which no state has. So we've been tackling these issues. And as far as Karnataka is concerned, we have been growing most of the this thing which is self-sufficient, but this is not Karnataka issue. It is an entire global issue, not even Indian issue.
Absolutely.
So it has to be tackled in that way.
Well, it's a good speaking to you. Thank you so much. And I hope, there is more investment, and I hope that the Karnataka story, which has been dominant in Davos for so many years, continues. I'm sure it will.
See, I am a very optimistic person, very hopeful. Here, after coming to Davos, I was speaking to a lot of people who have invested. I am going to invest. I am not only hopeful, I am very confident that much more is going to come, and we are going to have a global investor meet in November. And that will be a very, very, very big ticket event. And looking forward for not only in terms of investment, in terms of finances, but in terms of technology.
Sure, that should be great. Thank you, sir. Thank you very much.